Yep, go ahead. There we go. Thank you.
All right, there we go. So today's discussion, brain injury overview, different types of brain injuries, risk factors, brain areas and functions, changes after a brain injury, special populations, accommodations and strategies, screening tools, and last but not least, resources. Okay, so you guys can come off of mute for this question, or you can type it in the chat. So, how many people in the US are treated in emergency departments, hospitalized, or die as a result of a traumatic brain injury? Anyone want to take a guess?
I don't know if you can hear me. See,
Okay, we got a 1.2. Anyone else?
maybe 2.8.
Okay, we got a 2.8. So the answer is 2.8 million traumatic brain injuries a year. 56,000 of those people die. 282,000 of them are hospitalized, and 2.5 million are treated and released from the ER. Okay, brain injury overview. So we're going to get into different types of brain injuries. So there's two different type of brain injuries. We have acquired brain injury, which is ABI, or traumatic brain injury, which is TBI. ABI is defined as an insult to the brain that occurs after birth, caused by internal factors. This can include stroke, aneurysms, or apoxia or hypoxia, which is lack of oxygen to the brain, or a tumor. And then TBI, or traumatic brain injury, is when an insult to the brain is caused by external force or physical force. This can include car accident, falls, sports injuries, assaults, or you name it. All right, what do you think is the most common cause of TBI? Going to be interactive here. Anyone?
Do the car crashes.
Car crashes. So, common causes of non-fatal TBI, falls are 47%, someone being struck 15%, accidents are actually 14%, assaults 9%, and unknown 8%, other would be 7%. Shocking that falls would be 47%. You would think it would be car accidents. And we also have to remember that some of these traumatic brain injuries do go unnoticed or undiagnosed as well. All right, so we have levels of severity of TBI. So we have mild, which is about 80%, and that's just for people who probably lose consciousness for 30 minutes or less, and post-traumatic amnesia that doesn't last too long, probably about an hour or so. Then we have moderate, which holds 10 to 13%, and that happens for around 30 minutes to 24 hours. And then they also have PTA for 1 to 24 hours. And then for severe, which is 7 to 10% of people, they have LOC for 24 hours or PTA for greater than 24 hours. Men are twice as likely to sustain a traumatic brain injury as women. True or false?
true.
Yes, this is true. So, some factors that go into this is age, impact of sports, and of course, their gender. So, men are twice as likely to sustain TBIs. Um, they do more physical type of work and things of that nature. They have uh something in them that tells them to take more risks than women do. So, also impact of sports. Young people who play football and other contact sports are at increased risk of concussions. In the last few years, the number of TBI incidents has more than doubled for athletes that are age 19 and under. Also, young children and older adults are more likely to sustain TBIs from falls. You see, adolescents have a higher rate due to car crashes and unintentional injuries. All right, so other risk factors for TBI, these are people who are more likely than others to sustain a TBI, which would be people who abuse substances, people who are incarcerated, people who are homeless, and people who already have a history of TBI. So there are a lot of people that have multiple TBIs after acquiring one. So after the initial injury, you are 3 times more likely to have another injury. And after the second injury, you are 8 times more likely to have another injury. Okay, how much does the adult brain weigh? Anyone want to guess?
3 pounds?
So we're going to get into that when we talk about the brain area and associated functions. So for the frontal lobe is responsible for the executive functioning or higher cognitive skills. So this is the frontal area of your brain, and this area is responsible for problem solving, spontaneity, memory, language, motivation, judgment, impulse control, and then social and sexual behavior. Um, the temporal lobe is it plays a role in emotions and is responsible for your hearing, understanding language, comprehension, organizing and sequencing, your memory, smell, taste, perception, understanding music, your aggressiveness, and sexualized behaviors. And then we have the parietal lobe, which is responsible for integration of different senses. So it works with how your senses incorporate and work together. It also is responsible for goal-directed voluntary movements and manipulation of objects. And then you have your occipital lobes, which is responsible for vision and recognition. And that is in the further back of your brain. Okay, so the brainstem is responsible for breathing, your body temperature, your digestion, alertness, and also swallowing. And then you have the cerebellum, which is responsible for coordination of voluntary movement, balance, and equilibrium, and then some memory for reflexes and motor acts as well. Okay, what effect can a brain injury have on someone? Common physical changes in someone with a TBI initially would be headaches, changes in sleep, fatigue, dizziness, balance being off, and then sensory changes. Less common physical changes would be hemiparesis or hemiplegia, which is mild or partial weakness or loss of strength on one side of the body, similar to what someone would experience when they would experience a stroke. Apraxia, which is having trouble cooperating with the person's best intentions, and then spasticity, which is the limbs may be stiff or weak or limp. And the range in movement is very limited. And then also their bladder or bowels could be impaired in the early days to weeks following the surgery as well. Cognitively, some changes could be executive function, which is memory and flexible thinking, as well as self-control. Aphasia is a really big one. It's an acquired neurogenic language disorder, and it results from the injury of the brain, and is most typically on the left hemisphere. So aphasia is just when a person is having trouble getting their words out or enunciating or pronouncing words. Also, confabulation, which is a symptom of various memory disorders, in which made up stories fill in any gaps of memory. So I see this a lot with some of my caseload where you'll ask them something about their past, and I've had I'll see them one day and they'll tell me, "Oh, I need to call my daughter," and I know from being their case manager that they don't have any children. So confabulation is what causes that. Um, Also persistence and preservation. So this is when they're unable to move on to another topic almost like beating a dead horse. It's like they have to be persistent in staying on whatever topic that is on their mind in that moment. So for behavioral changes, a person with a TBI may experience emotional lability, which is known as severe mood swings, changes in the way that they react to certain situations. Um, Flat affect, which is not they don't express emotions in the same way other people might. Anxiety is another one, which everyone without a brain injury sometimes even suffer from anxiety, but after a brain injury, it impacts their daily lives a bit more and it could obstruct their rehabilitation. And then another one is also aggression. This is one of the most common personality changes after a head injury is increased aggression. Okay, co-occurring diagnosis, and we're going to understand the link between these. So, mental health and TBI. I literally just did a webinar on this yesterday. So, understanding the link with someone, some individuals with TBI have a pre-existing mental health condition. And intentional self-harm is the first leading cause of TBI related to death as of 2014. A lot of people on my caseload have uh, acquired their TBI by a failed suicide attempt. TBI can exacerbate pre-existing mental health conditions. So could be someone that already has anxiety, already has depression, or is already diagnosed with some sort of mental health disorder, and then they acquire a TBI after it, and that TBI now exacerbates those conditions. Um, People may struggle with depression after a TBI due to changes to the brain, changes to their employment situation, family situation might look different, and their relationships often change as well. And there are also factors that are unrelated to TBI that do impact this as well. Okay, substance use and TBI. So TBI can be a triggering event that causes people to change their substance use patterns. Use does not constitute abuse or misuse, but substances can have a negative effect after a TBI, especially alcohol. So TBI alcohol increase risk of seizures. It can increase risk of having another TBI, and it can magnify cognitive problems as well as exacerbate depression. The best practice after TBI is no alcohol or no substances. All right, we're going to talk about our special populations. So, older adults, increased fall and risk would be something that would probably hinder after the TBI. Neuroplasticity, which would decrease with age, which just means the ability for your brain to stretch and heal would decrease. And then brain atrophy would be over time. So just depletion over time after a TBI, especially if it was a severe one. Service members. So TBIs are more common among military personnel than in the general population. 80% of TBIs since September 11th have been non-combat related. And TBI is considered the signature wound in Iraq and Afghanistan wars. So it's very, very common among military personnel. Homelessness. So 73% of people had their first TBI before adulthood, if they were experiencing homelessness. And then 87% of them, their TBI had occurred prior to their homelessness, and likely is a cause of the reason why they are homeless. TBI increased housing instability severely. And then we also have incarcerated individuals. The estimated prevalence of TBI in the offender population is 60.25%. Within 5 years of injury, 1/3 of the individuals report some involvement with criminal justice system. Um, it, and we know the conditions that the jail is in. A lot of things going on in there. So some people do acquire a lot of TBIs during their time of being incarcerated. Then we have domestic violence. So DV is a pattern, a cycle of abuse leading to multiple injuries, and multiple studies suggest that perpetrators could have a history of TBI and could also inflict TBI onto the victim as well. Okay, which of these celebrities has not had a TBI? Anyone want to guess?
George Clooney.
Pretty sure it's not Ben Roethlisberger.
No. So yes, you're right. It's George Clooney. Correct. All right, we're gonna go into screening tools. All right, so for assessment, this is a process for defining the nature of the problem, determining the diagnosis, and developing specific treatment recommendations for addressing the problem or diagnosis. An example of this is Mayo Portland Adaptability Inventory, and it's just a scale that is used to assess a TBI. And then we have other screening tools. So screening tools is a process for evaluating the possibility presence of a particular problem. The outcome is normally a simple yes or no type of question. So example of this is the Ohio State Identification Method. HELPS is another one, and then the Brain Injury Screening Questionnaire is another one. And those are all just a series of yes or no questions to assess a brain injury. All right, some other screening tools. OSU TBI is a standardized procedure for eliciting lifetime history of TBI via a structured interview. BISQ, uh, this screens for lifetime history of TBI and reduce the consequences of undiagnosed or untreated TBI. The BISQ is a structured questionnaire that characterizes incidence and severity of lifetime exposure to head trauma and TBI. And then we have HELPS, which is a brief screening device for determining if a person may have experienced a traumatic brain injury at all. For OSU TBI, this is a 3 to 5 minute screening tool to elicit lifetime history of TBI. It identifies possible undiagnosed TBI, which many people do have, and it does not account for all types of brain injury, just for TBI. And this is an example of OSU TBI. So this is how a provider would conduct the interview. There is 2 sets of 3-step procedures, and this is what they would go by. Okay, so for BISQ, it's this structured questionnaire. It has 4 different domains, and that includes attention and memory, depression, anxiety and mood, aggression and impulsivity, and then physical symptoms. HELPS has 5 questions. They draw out information about possible TBIs, and individuals may not recognize head injury. So HELPS is a standardized questionnaire that is used for that. And this is an example of HELPS. So it is the acronym, and it gives you each question for each letter, and then the person would just simply answer yes or no. So for every question that they answer, they score 1 point for every question that they answer yes, and a score of 2 or more in the P function would be considered a sign of possible injury. All right, so interpretations. Possible cognitive and emotional problems would be something that is interpreted from these tests the first time that they had the TBI and if they have multiple injuries, and then also how recent was the last injury as well. Accommodations would be something that would be considered, some simple accommodations that could be used to assist the person immediately would be something that would be discussed as well. All right, accommodations and strategies. So, getting started, of course, we always want to avoid arguments with a person with a TBI. We also want to avoid feeling like they are being quizzed instead of trying to offer memory cues to them. And always want to remember to be patient. For communication skills, we want to make sure that we are treating the person with a TBI like an adult. Of course, we don't want to down talk the individual. We want to make sure that when having an important conversation, that we're, lending one idea at a time so we don't overwhelm them. And we also want to make sure that we're using our ABCs, which is accuracy, brevity, and clarity. So we want to make sure that we're being as accurate as possible, if we can, as brief as possible, and then be as clear as possible. Helpful strategies for cognition would be step-by-step instructions, possibly labeling things, using visualization, and giving association cues as well. For behavioral, we could identify triggers, so like helping them understand what they feel right before an angry outburst or before they get overwhelmed. Make the de-stimulation plan, which is just to have a plan for when they're getting overwhelmed, and helping them to make sure that they can name the emotion so they can acknowledge, just making sure that they can acknowledge and understand what has happened, and who can help. And then treatment. So long-lasting symptoms will not resolve without treatment. All right, so different types of treatment. We have neuropsychiatrists, which start with the outline of topics and identify highlights, which can be applied to whatever subject you plan on discussing. Then we have neurologists, which start with the outline of topics and identify highlights, which can be applied to whatever subject that they're discussing at that moment. And then we have neuropsychologist, PT, which is physical therapy, OT, occupational therapy, and then we have speech therapy as well. All right. Key takeaways. So, what is a brain injury and the different types? And the takeaway from here is that a brain injury is a brain that one acquires after birth. There are non-traumatic brain injuries, also known as ABIs or acquired brain injury, and then we have traumatic brain injuries that are caused from trauma. What is executive function and how does it relate to brain injury? Executive function is a set of mental skills that include working memory, flexible thinking, and self-control. And we use these skills every day to learn, work, and manage our daily lives. So when one's executive functioning skills are damaged, it can make it really hard to focus, follow directions, handle your own emotions as well as others, and move successfully throughout one's environment. And then how can we tell if someone might have a brain injury and what can we do to better serve them? So we can implement the use of the brain injury screening tools, suggest the use of compensatory strategies, and be patient and remember to direct when communicating and ask the best way to serve the individual. All right, we can get into resources. So, of course, we are a resource. Creating a better future through brain injury prevention, research, and education and advocacy. Our website is www.biamd.org, and our phone number is 410-448-2924. We also have an email, which is info@biamd.org. And funny enough, Beth, because it is Brain Injury Awareness Month, we normally have a conference every year around this time. This year, our conference will be April 9th and 10th, right in Reisterstown, Maryland. And then community resources. So support groups for people with brain injuries and caregivers. You guys can go right to our website and go under support groups, and we have a whole list there. For caregivers, Caregiver Action Network, their website is caregiveraction.org, and their phone number is 855-227-3640. And then we also have Maryland Family Caregiver Support Program. Their website is www.aging.maryland.gov, and the phone number is 1-800-243-3425. Additional community resources would be able to be found on Maryland Access Point website, and that website is www.marylandaccesspoint.info.org. For our references, they are listed here. If you guys would like to read up some more on brain injuries, you can go to these sites listed here once Beth has posted the presentation. For additional training, we do have training offered by BIMD. We have brain injury fundamental courses, which is designated to address the unique needs and challenges for those who care for or encounter individuals with brain injury. We have CBIST, which is Certified Brain Injury Specialist Trainer. They demonstrate advanced skills in the field of brain injury and maintain their skills through continuing education. Some of them may have a brain injury themselves, so they're able to give more information in that realm. And then topics on brain injury, any topic related to brain injury as far as brain injury and aging safety, domestic violence and TBI, TBI and mental health, TBI, mental health, and substance abuse are all available. All right. Thank you guys so much for your time and for giving me the opportunity to share with you guys. I hope you gained something, learned something new, or are able to share something with someone else.
Thank you, Angel.
No
This is
problem.
fabulous. Yes.
Any
And
questions?
Well, Bryn, Beth, I would just like to mention that for people in Montgomery County, there is a brain injury support group at Adventist Rehab right in Gaithersburg that meets
wow.
on the second Thursday of each month. And it's usually at 6:30, and they have two separate groups. They have one for caregivers and one for the brain injured group. So that if you know somebody with a brain injury, or you're not sure if you know somebody with a brain injury, but you think that might be something in your life, you can come to the caregiver support group. Or if the brain injured person is interested, they could go to the brain injured group. So it's
Amazing.
like 30 minutes from Poolsville.
Great. Thanks, Suzanne.
Angel, I had a question. Is the event on April 8th and 9th, is it open to the public?
Yes. If you go over to our website, you're able to purchase tickets for it. I completely forget the cost. I know it's under $50.
Okay.
I'm almost sure it's under $50. So it's April 9th and 10th, Thursday and Friday. Yes. So from Poolsville, probably less than an hour because we do have providers in Montgomery County, and it probably takes me about 40 minutes to get that way from where I am. So probably less than an hour drive to get there for sure.
Okay. If by chance you have a flyer for that, if you can send it my way, I would love to
Sure.
maybe post that information. Yeah.
Sure.
Okay,
Yes,
great.
I will send that
I'd
to you.
appreciate that. Yeah.
No
Okay.
problem.
Okay. Are there any more questions for Angel? Okay. Thank you so much, Angel. We really appreciate this.
Thank you, guys.
Fascinating. I've learned some things, that's for sure. And I really appreciate your time and effort in doing this.
Oh, there's Suzanne put it in the chat. So that's the information for our conference right there.
Oh, great. Okay. Thank you.
Oh, you're fast.
Yep. Yeah, I got it. Thank you so much,
Thank you
Suzanne.
guys so much. I hope you guys have a great day.
You too. Have
All
a great
right.
one. Bye,
Bye-bye.
everyone.